damp though, so I think we can work this.
Can we stand on the table?
Honestly, if you want to get on the table, if you want to sit on the table, go
I
ahead.
got a few dollar bills back.
I need to get a...
Get a good view,
Sit on the
man.
table for a while.
Oh, pay me like one of your French cats.
Jesus, is this how this class is going?
It appears so.
Okay, listen,
Ah.
I'm totally okay with this.
Now,
Welcome to 7
a
p.m.
couple of things that you need to understand about cat muscles is that just because we have something in the human called something, it's not called the same thing in the cat all the time. So, like last week, you had your trapezius muscle that had 3 parts, and your deltoid that had 3 parts.
Humans only have one, right?
Humans only have one of each of those. In the cat, this side here is what we're going to call the dorsal side. This side is the ventral side. So the way you can tell the difference is the ventral side has these nerves and arteries going into it. Okay. So the first set of muscles that we're going to look at are the arm muscle. Remember, this is the arm, this is the forearm. Okay. So our triceps has they have 3 heads, 3 parts. The one that is cut is the lateral head. And it's directly it's on the lateral side, okay, of the cat. The long head is behind it, right here. So this is what you would normally think of your triceps in the human. Okay. Now the third head is the medial head, and we have to reflect this one to find it. Okay. So here's our medial head. So we have our lateral, long, and medial head of the triceps.
The lateral is cut.
The lateral is cut.
Thank you.
Just like the spinodeltoid will be cut on the deltoid one. Because in order to see the teres minor, you have to go underneath it. Okay. Now, this here is the radial nerve. And it is going to travel along with this muscle here called the brachioradialis. And the way you know that is because it's starting on the brachium and it's going to the radius. Okay, remember, the names of the muscles tell you a lot. Okay. So, let's go on this side. This side is your biceps brachii, right here. This is the same triceps, long head, on the, but looking at it from the opposite side. Okay. If this is the biceps on the medial side, on the lateral side, the muscle of which the radial nerve sits on, if you notice, is brachialis. So brachialis is on the lateral side, biceps on the medial side. Okay. This is also the radial nerve. Not the radial nerve, the ulnar nerve. Because it's going down into here. All right. Now, if we go to the forearm, it gets more complicated. Okay. So what I want you to do is everybody have their atlas with them while we do the forearm, because I'm going to show you an easy way to remember it, or at least an easier way to remember than just memorizing it. All right. So this is the dorsal side, and here is the dorsal side here. Okay. So if you notice, all the dorsal muscles in the forearm are extensors, just like in the human. The ventral muscles are the flexors. And muscles always work on the joint they cross, so that the tendon has to cross the joint in order to move the joint, and it always moves the joint that's distal to the muscle belly. In other words, so if the muscle belly is here, and it starts here and ends here, it's going to move the elbow joint. Right? If these muscles here across the wrist, and since it's on the ventral side, they're gonna flex the wrist. Okay, so that's one way of figuring out action. If you know the origin and the insertion, and you know what compartment it would be in, you don't have to memorize the action. It's very simple to figure it out by knowing the two attachment points. Because that's one less thing you have to memorize, since you have a whole lot to memorize. So that's one less thing.
I'm not gonna lie, you just taught me more than I've learned in the last 6 weeks.
Yeah, kind of.
All right, we're recording, so we don't want to talk bad about it.
Oh no, I'm not talking bad.
I'm just gonna need you to say your name and social really quickly.
All right, so now, these are your extensors of your wrist. So the way I like to do this is I like to always find the one muscle I know I'm going to be able to identify. Always. And that's usually the bigger one. All right. This one here. Okay. You can also do it by starting at the bottom. See these two here. This one here would be this number 10 in the extensor carpi ulnaris. Then you just count upwards. So 10, then 9 is this one, the extensor lateralis. Then it goes up again to communis. Then it goes up again to extensor carpi radialis brevis and longus. As long as you end up at brachioradialis, which is going to be this one that's away from everybody else, you know you're in the right spot. But if you learn them in order, the next one after extensor carpi ulnaris is radialis. It just keeps going in it kind of goes around. And there's a mnemonic, and honestly, I don't remember the mnemonic off the top of my head. We can look it up. But the first letter of each of these muscles has there's a sentence that goes all the way around. If you could find that on the internet somewhere. But sometimes mnemonics are harder to remember than the actual stuff. All right, so that's the extensor side. The ventral side is a little easier because of this one big muscle in the center of it, right? This muscle is called pronator teres, and the way I do it is if I know pronator teres is here, I remember the muscle beneath it and above it, and then I remember two beneath it and two above it, and do it as a pattern, because the pattern will always be the same in all these cats. It's just that the size is different. And the bigger cats, and I know you're recording this, but in anatomy, size matters. Okay? That's why we have maximus and minimus and all these different terms for size. Okay? Now, in lecture, you talked about the retinaculum, hopefully, right? The extensor retinaculum and the flexor retinaculum.
I don't know what that even is.
Okay. All right. So let's talk about it. You see this connective tissue right here?
Yes.
Where the muscles go underneath?
Yes.
Okay. In order for a muscle to have its what we call mechanical advantage, its best physics to work properly, it needs to be as close to the bone as possible. So we have this connective tissue that's holding the bone, kind of like a wristband when like an athlete would wear a wristband, right? It goes around the extremity, the distal end, holds these structures close to the bone. The one on this side is called the flexor retinaculum, because it's on the flexor side, and the one on the extensor side is called the extensor retinaculum. They're two separate structures, but they tend to hold the tendons closer to the bone. So that and those are in here on here, flexor retinaculum, right here. Okay. So that's the upper extremity in a nutshell. Lower extremity is actually easier, although it looks more complicated because it's bigger. Okay. Thigh, leg, medial thigh.
You got it. This might be better.
Medial thigh is here. Lateral thigh is here. Anterior thigh is here. And posterior thigh is here. So let's get our orientation. Okay. The medial thigh muscles are adductors. They adduct the thigh. In other words, they bring the thigh closer to the midline. Okay. The biggest one, again, is going to be transected. It's going to be cut. It's called gracilis. If you open and retract, you see the deeper ones. The one back here is called semitendinosus. It's thinner. The one next to it is semimembranosus. It's thicker. This one here is adductor femoris. Adductor longus is this one here. And pectineus is actually
I was gonna say, where's that one? That's the only one I know.
that because that's
Pectineus.
it's really small and it's kind of destroyed. But it would be right here. Okay, so we got pectineus, longus, femoris, semimembranosus, semitendinosus. All of that covered by gracilis. On the front of the thigh is another muscle that's transected. If you remember the transected muscles, it makes life easier. That transected muscle here is sartorius. And if you reflect that out of the way, you see the hot dog in the bun. Okay, here's the hot dog.
Yep.
Here's the bun. The hot dog is rectus femoris, straight muscle of the femur. Rectus means straight. Vastus medialis and vastus lateralis are the bun. Just remember which side is medial and which side is lateral. Now, underneath this, which we're not going to cut this, but if you were to transect this and reflect it, you'd see a smaller muscle underneath it. That's called rectus intermedius. Or rather, vastus intermedius, right? Vastus intermedius. So vastus intermedius, rectus femoris, vastus medialis, and lateralis, there's 4 of them. Those are your quadriceps. Right, they're quads. And all of those, if you're going to notice, are going to insert right here on the tibial tuberosity. Here's the patella, tibial tuberosity. These are muscles that when they contract, extend the leg. Okay? Which is why when the doctor hits your patellar tendon, it causes your quadriceps to fire.
Stretch receptors, right?
Because of the stretch receptors in those muscles. That's correct. All right, now, so that's the anterior. You also see some blood vessels. You see the femoral artery, the femoral vein. You see branches of the femoral nerve as well. Okay, nerves. If we go to the posterior, we've already seen the posterior muscles, right? So this again is biceps femoris. This is your semitendinosus and that big semimembranosus. Same one. That's I'm going to put right there. Same one. Leg. The only 2 you really have to know on the leg, here's your calf muscle. It's your gastrocnemius, which inserts on the calcaneus by the Achilles tendon or the calcaneal tendon. So when you pull this, so if the foot is like this normally, and you pull this tendon, it plantarflexes the ankle. Okay. All right. So that pretty much is the appendicular muscles you need to know. Okay.
Cool.
Easy peasy.
Well done.
Now let's take these muscle names that we just did on the lower extremity, and since those models are out, let's do the same thing on the model because who knows if it'll be on the test. So let's go over there and look at the big plastic model.